Good morning and welcome to our discussion. Today we're going to be talking about hero training. Have you ever wanted to be a hero? Well, if you have, then I'm going to show you something that will help you save a life and become someone's hero. Since the development of CPR in 1960, many lives have been saved by everyday heroes just like you. The same techniques that are used by professionals can be taught to anyone. The process is simple and easy to learn. So put on your hero capes and let's get started. In the next few minutes, I'm going to show you and tell you how to perform CPR in 3 easy steps by remembering the ABCs of care. According to the American Heart Association, who are the leaders in the field of the development of this training, they want us to remember A for airway. We want to maintain and keep an open airway. B is for breathing. We want to give 2 rescue breaths. And C is for compressions, properly doing compressions and checking for circulation. The information and the techniques that I'm going to show you have been developed by the American Heart Association and the American Red Cross. CPR, what does it stand for? Cardiopulmonary resuscitation. It is used in the event of a cardiac or respiratory arrest. By remembering these 3 simple steps, it is possible to restart the heart and to reestablish breathing. In return, this saves a life that would otherwise be lost. So let's get started, and I'm going to show you how we're going to put all 3 of them together, our ABCs. The first thing we want to remember is our airway. We want to look in the person's mouth and see if there's anything obstructing the airway. By using a head tilt, lift the chin, and look inside the mouth. If there's something in there, we want to quickly remove it without pushing it further into the throat. Next, we're looking and listening and feeling for breath. We're watching the chest rise. If we see nothing, then we know our person needs 2 rescue breaths. We're going to push the head back with the head tilt, chin lift, pinch the nose, and give 2 rescue breaths, watching for the chest to rise and fall. We want to give those over a 2-second interval. The next thing we want to do is to start our compressions. And the way that we do this is to create an imaginary line between the nipples, going straight across the chest. Then in the center of the chest is a concave area. We want to put the heel of our hand in the center between the nipple line. Place your other hand on top, and you're going to want to do the compressions by pushing hard and deep and fast to a rhythm of you can remember the Bee Gees, staying alive, staying alive, staying alive. You're going to want to do cycles of 30 compressions to 2 breaths. And that will give you, if you continue that rhythm, that will give you 100 compressions per minute. Now that we've shown you how to do this, what you want to remember is that when the patient is in this position and they have begun to breathe again, then you want to turn them onto their left side with their right knee on top, and this knee will be placed on the ground. This will keep them from rolling over, and this is what we call the recovery position. Now, in conclusion, we want to see that learning these critical steps is very simple and very easy. It is by remembering the ABCs of emergency care. CPR saves lives and it takes minimal training. Let's recap what we talked about. We want to manage our airway, give rescue breaths, and we want to do our proper compressions. We want to always remember that time is of the essence. We want to take no more than 5 to 10 seconds if we check the pulse in between doing compressions and our second round of breathing. What the American Heart Association wants you to know is that heart attack is the #1 killer of Americans. And by knowing and performing CPR, it's possible to save lives and prevent death. If we need to perform this critical skill, knowing these steps will give you confidence and peace of mind. If you want further information or certification, you can contact your local American Heart Association or American Red Cross. Thank you so much.